remember tripping over and cutting your knees and magically the bleeding suddenly stops? Or have you even wondered why it happens? Our body is very clever in producing substances and sealing off the open wound. Well, in this video, we will take a look at how and why blood clots. Clotting prevents us from bleeding to death and also protects us from nasty disease-causing organisms called pathogens entering our body. When they enter our cells, we can damage the blood vessels just below our skin. This can cause blood to leak in our tissue and form burrows, or the skin is broken that openly bleed. To prevent this happen, blood clotting occurs. So let's take a look how it happens. Starting with platelets. These are tiny cell fragments that flows around in our blood. When the blood vessel is damaged, collagen is exposed. This collagen exposure attracts platelets to adhere to the injury area. The platelets then stick together to form a plug. They quickly build a barrier that stops us from losing too much blood. However, this platelets plug isn't that strong, so it needs to be made it stronger. A protein called fibrin does exactly that. In our blood, there are soluble fibrinogen proteins. After wound, these soluble fibrinogen proteins are exposed to outside chemicals that aren't normally found in blood vessels. Like the collagen and platelets, this exposure caused the fibrinogen proteins to turn into sticky fibrin fibers and form a mesh, holding all the platelets together, making a much stronger clot. This clot stops more blood escape from the body and also prevents nasty pathogens entry in our body from the outside. The clot develops into a scab, which protects the wound as it heals, and new layer of skin form underneath. So what do we mean by scab? It is just platelets trapped in a fibrin mesh. It is like putting a plug in a sink. When the new skin is fully formed, the scab will fall off, revealing the lovely brand new skin underneath. Remember, the said exposure to the collagen causes the platelets to stick together, and the exposure to outside chemicals causes the fibrinogen proteins to turn into sticky fibrin. Both the platelets and the fibrin only become sticky after the exposure. This means in a normal healthy blood vessel, they won't randomly cause clots. So, this video helps you understand the magic of blood clotting, platelets, fibrin fibers, blood clots, and nasty pathogens. If you learn new things today, please give a thumbs up and subscribe. See you in my next video.